So our cardiac patient James Leigh is a 52-year-old male living with his wife and 2 daughters. He currently has a full-time job as an accountant. After experiencing chest pain for a month, James visited the GP and described his pain as being in the epigastric region. He rates his pain a 4 out of 10, which alleviates with rest, and describes it as being a tightening feeling in his chest. Originally, James thought it was a heartburn. He also explained that he experiences shortness of breath while walking on a slight incline on the way to work. After being tested for the level of troponin in his blood, James was referred to the emergency ward by the GP. His vital signs were taken instantly. His heart rate is 78 beats per minute, respiration rate 16 breaths per minute, blood pressure is 140/88, his oxygen saturation is 99%, and the temperature is 36.8 degrees Celsius. James mentions that he has no known family history of coronary heart disease and has never undergone surgery. He doesn't smoke nor consume alcohol. He has no known allergies and doesn't take any medication. James points out that he exercises once or twice a week in the form of running and participates in an annual 15-kilometer running event for the last 8 years. He claims that his eating habits are healthy. However, his wife says he binges on unhealthy food while working and after dinner. James has high cholesterol and no diabetes. His BMI is 30, therefore he is overweight.
So I'm going to be talking about the pathophysiology of coronary artery disease. So basically what it is, it's the build-up of plaque or fatty deposits on the artery walls that causes the lumen to narrow, and this restricts blood flow. So basically the heart has its own supply of blood that basically gives the myocardium its own oxygen and nutrients that it needs for optimal functioning. They are made up out of 3 major coronary arteries, which consist of the left anterior descending coronary artery. We got the left circumflex artery, and we got the right coronary artery. So I drew up an artery to make it easier for you to understand. So what the arteries are made up of is basically a thick muscular elastic wall. This is to withstand pressure, because you can imagine someone with hypertension, the pressure of the blood going through, if it's really high, it's obviously going to cause damage to the arteries, and this is going to make you prone to atherosclerosis, which is basically a build-up of plaque. So the plaque that I circled here in the blue, if it's something like that, like a little bit of it, it's not really going to restrict blood flow as much. Oh, before that, I should tell you that the arteries basically have red blood cells and something called low density lipoprotein, which is basically fat and or fatty deposits. Accumulation of that, it causes the plaque that I circled. So just to clear that up. But anyways, a build-up of plaque can worsen and become larger, and if it becomes larger like it is with the whole orange, then it can obviously cause a blockage, and this can cause like a lot of heart problems such as like angina, myocardial infarction, heart failure, arrhythmias. But I'll discuss the stages that are summarized of the build-up or development of atherosclerosis in the next few slides. So now we will be talking about the 3 stages of the development of atherosclerosis. So the 3 stages are basically intimal-xanthomal. There is the fibrous plaque, and there is the complicated lesion. So in the first stage, what happens is basically the artery becomes damaged. So the inside, the endothelial muscle and the smooth muscle becomes damaged. And what happens is that there's an inflammatory response, and that allows entrance to LDL proteins. So the entrance of the LDL proteins will initiate a pro-inflammatory response. So basically, a production of white blood cells will engulf the oxidized LDLs, and this can promote the hardening or the thickening of the plaque. And yeah, so as a result, the plaque has a fibrous cap made out of smooth muscle, and as time goes on, it'll develop and get bigger and bigger, and obviously it's going to restrict blood flow the bigger it gets. So we'll go speak about the next stage soon. So the next stage is the fibrous plaque stage, and in this stage, basically, this is where the thickening of the plaque occurs. The reason for this is because macrophages, smooth muscle cells, and the lymphocytes are filled with cholesterol. This causes the lumen to narrow, and when the lumen narrows, obviously there's going to be a restriction of blood flow, and this is the stage where it causes like chest pain. And if it leads to a rupture, this is going to cause a lot of heart problems, such as like heart failure, myocardial infarction, or arrhythmias. So in this stage, basically, the foam cells from before, they release platelets and endothelial cells, or they activate platelets and endothelial cells to release naughty enzymes. So basically the enzymes here, what they'll do is they'll digest the fibrous cap, and they'll cause the cap to thin and eventually lead to a rupture. And a rupture will then lead to basically something called thrombosis, or sometimes known as a blood clot. So that will be in the next stage. So the next stage is complicated lesion, and in this stage is basically where the rupture or the plaque occurs. And when the plaque ruptures, something called luminal thrombosis, and that basically causes a blood clot. So when there is a blockage, it does lead to myocardial infarction, heart failure, angina, or arrhythmias. It is really dangerous, so you wouldn't want to get to this. So to basically summarize that up, keep it short and simple, the development of atherosclerosis can be simplified into 5 steps. So number 1, it starts within the arteries. Number 2, plaque forms on the lining of the artery due to an inflammatory activation. Number 3, plaque grows and the artery becomes damaged. Number 4, the plaque ruptures. And number 5, basically luminal thrombosis, which is the blood clot that restricts the blood flow and lead to potential heart problems.
In order to help James Leigh get back to his normal self, the nurse needs to administer medication that counteracts his symptoms of CAD. It is imperative that every health professional that is looking after James adheres to Standard 4 of the National Safety and Quality Health Service Standards. This includes constant medication documentation, monitoring of adverse reactions, and adhering to the 7 rights of medication administration. It is clear that the patient is experiencing blood pressure that is above the norm indicated by his 140/88 blood pressure reading. Therefore, antihypertensive need to be administered. This can be done in several ways, including calcium channel blockers, beta blockers, and ACE inhibitors. Calcium channel blockers work in a way that decrease the myocardium's demand for oxygen by decreasing the peripheral vascular resistance. In this situation, James should be given amlodipine, a calcium antagonist. This drug is a dihydropyridine, which works by blocking specific L-type calcium channels, inhibiting the influx of calcium ions from entering the vascular smooth muscle. As such, there will be a decreased peripheral smooth muscle resistance, which will result in a decreased blood pressure. As with any drug, this calcium channel blocker has several contraindications that need to be considered before it is prescribed and administered. Amlodipine is contraindicated in patients who are known to have sensitivity to this drug. The common side effects with this particular drug include headaches, bradycardia, postural hypertension, dyspnea, flushing, and peripheral edema. Some of the rare side effects that can occur include black tarry stools, bleeding gums, and painful urination. It is imperative that the nurse educates James about this drug and that if he has any side effects, he should contact his doctor immediately. It is vital that the nurse undertakes constant vital signs to make sure the drug does not interact with any other medications prescribed and cause a sudden decrease in blood pressure. The nurse should also monitor blood pressure for postural hypertension as well as dose-related palpitations. Beta blockers are the first drug of choice to lower hypertension in patients who have CAD, which cause angina. Considering that the patient in this scenario is experiencing stable angina, it would be fitting to use drugs that reduce heart rate, workload, and cardiac output, which would thus lower the blood pressure. This patient should be prescribed atenolol, as it not only is used as a hypertensive but also as an anti-anginal. It works by blocking beta receptors in the heart and arteries, which decrease heart rate, blood pressure, and depress the SA node, which will increase the period between contraction of ventricles. The general precautions for atenolol are abrupt withdrawals, diabetes, elderly, pregnancy, lactation, and children. It's contraindicated in people who suffer from severe peripheral arterial circulatory disturbances, sick sinus syndrome, bronchospasms, and congestive heart failure. It is important to note that people who have a history of heart failure should not take this medication as it depresses myocontractility and may result in cardiac failure. This drug can cause indigestion, bradycardia, rash, alopecia, diarrhea, impotence, nightmares, vertigo, and depression. As such, the nurse needs to assess the ECG for bradycardia or any other arrhythmias, assess the frequency of angina, take blood pressure standing and lying down, educate the patient regarding the drugs, and monitor changes in mood as this drug may result. Another type of drug that may be used to decrease blood pressure would be an angiotensin-converting enzyme inhibitor, which prevents angiotensin 1 from converting to angiotensin 2, which results in vasodilation and decreased sodium water retention through the kidneys. In James's scenario, perindopril would reduce the risk of going into cardiac arrest or experiencing myocardial infarction, as there is no previous history of heart failure or hereditary coronary artery disease in his family. This drug is contraindicated in patients who suffer from renal impairment and have a history of angioedema and hemodialysis. Avoid using this drug with other drugs that increase potassium concentration, as it increases the risk of patient experiencing hyperkalemia. Precautions should also be taken if there is a previous history of surgery. Considering that these things do not relate to James, it would be fine to prescribe it. ACE inhibitors have been known to cause severe prolonged hypertension, which may result in acute renal failure or infarction of major organs, as well as cough. The nurse should monitor the vital signs and ECG constantly and monitor kidney function, as well as neutropenia, which result due to ACE inhibitors decreasing white blood cell count. The cough also should be monitored, and the nurse should make sure that the patient immediately reports any signs of nausea, irregular heartbeat, faint pulse, or weakness, as these are signs that are consistent with hyperkalemia. Platelets have an effect on atherosclerosis. As a result, by using antiplatelets, platelet aggregation decreases and thrombus formation is inhibited. Thus, the buildup of plaque should decrease. Considering that James has high cholesterol, the drug that would prove to be effective would be clopidogrel. This drug works by inhibiting ADP from the platelet receptor P2Y12, which results in an inhibition of ADP-induced activation platelets, resulting in prolonged bleeding time. This drug is contraindicated in patients who have a hypersensitivity to clopidogrel, experience severe liver impairment, and have an active pathological bleeding. It is important that patients who are consuming this drug do not continue taking it before surgery, as it may result in complications. The side effects of this drug include bleeding, diarrhea, rash, abdominal pain, hepatitis, and acute liver failure. Considering the side effects, the nurse needs to ensure that there is a continuous monitoring of the liver. As with every drug administration, there needs to be vital signs performed to ensure that there are no adverse reactions to the drug, and if there are, they need to be corrected. The skin should be observed for any changes, and the nurse needs to educate the patient to immediately report sudden changes in chest pain and shortness of breath. In order for James to lower his cholesterol level, it is vital that he is prescribed a HMG-CoA reductase inhibitor, more specifically a statin. These drugs are the first choice to lower lipids as they reduce the risk of cardiovascular events. They work by inhibiting HMG-CoA reductase from being synthesized, which results in increased cholesterol uptake from the liver, thus reducing cholesterol. Generally, atorvastatin is well tolerated, however there are some adverse reactions that may occur and the patient needs to be aware of them. The most common side effects include headache, difficulty sleeping, flushing, nausea, rash, constipation, peripheral ischemia, syncope, tachycardia, traumatic reactions, back pain, hot flashes, insomnia, abnormal vision, and dry mouth. This drug is contraindicated in anyone who has acute liver disease, women of childbearing potential that are not using effective contraception, and lactating people. Precautions should be taken in people who have just had a stroke, high doses, trauma, surgery, severe acute infection, muscle pain, weakness, and severe coronary artery disease. There should not be any stop-starting of this medication. Stopping the medication is associated with an increased risk of cardiac events. However, if the patient has persisted elevated aminotransferase concentration and there is a persistent muscular pain with no explanation, the statin should be ceased. There should also be constant blood tests that monitor blood cholesterol and triglyceride levels undertaken. Considering that the patient is showing symptoms of experiencing stable angina, it is important to give him pain relief. This can be done by giving him glycerol trinitrate in the form of a nitrolingual pump spray. Nitroglycerin acts to vasodilate, which will in turn reduce preload to the heart and decrease myocardial oxygen requirement. This occurs when nitrate is converted into nitric oxide within the cell. This nitric oxide then stimulates guanylate cyclase, an enzyme causing the intracellular concentration of cyclic GMP to increase, causing vasodilation. This drug is contraindicated in anyone who has an allergy to the active ingredient, which in this case is a nitrate component, or anyone who has an increase in intracranial pressure, as well as patients who are taking phosphodiesterase type 5 inhibitors. According to James's initial assessment, he does not appear to have any of these issues, and therefore this drug should be useful in decreasing pain. Precautions should be taken with anyone who has cerebral vascular disease, severe atherosclerosis, and lung disease. The side effects include headaches, hypertension, syncope, tachycardia, dizziness, nausea, and vomiting. This spray should be used with caution in this patient as he has hypertensive medication. As a result, there needs to be constant surveillance of his current condition to prevent bradycardia. Pain levels should also be assessed regularly.
The nurse should plan carefully as continuous care in the emergency department is imperative. Once the patient is submitted into ED, the nurse must emerge quickly and do tasks effectively and efficiently. The collaborative team within the ED must work together to be efficient in their assessment findings and provide a prognosis for James. People involved in this clinical scenario would be a physician, a cardiologist, also a specialized nurse within the cardiology field. They must work together as a multidisciplinary team to ensure the best possible outcomes for James.
Nursing Intervention 2, Vital Signs. Monitoring vital signs within ED is the nurse's duty. Changes can show deterioration within the body, and thus nurses can immediately act upon the situation. It also establishes a baseline for nurses to see if any intermediate changes are occurring within the patient. Blood pressure submitted shows signs of systolic hypertension, may be due to reduced compliance of the aorta, increases the load on the ventricle and comprises coronary blood flow. The nurse should record blood pressure in both left and right arms when a patient presents with chest pain. A difference of greater than 20 mmHg may indicate aortic distension and can assist in formulating diagnosis. Oxygen saturation is checked to see if the blood has adequately supply of oxygen. This could be affected due to his condition, coronary artery disease. Heart rate taken and pulse and character should be noted. Auscultating the heart and checking for sounds for regular rhythm. Respiratory distress is evident as James is showing signs of shortness of breath with pain from his chest region. Vital signs should be monitored on regular intervals to ensure James' condition is not worsening. Monitored after medication is given to see if the medication has taken effect and to see if there are adverse effects from the medication. High cholesterol and BMI 30 are risk factors that should be addressed adequately by the nurse. Intervention 3, Pain Assessment, allows the nurse to gain an in-depth understanding of the patient's experience of pain, which thus allows them to effectively manage the pain. Screen for a pain assessment prior to, during, and after procedure, as this is essential to see if any changes has arisen. Quality and intensity of pain must be understood as nurses need a multimodal approach to address it. This pain assessment encourages James to be honest about level of pain experiencing. It initiates them to self-report pain if the condition is getting worse. Self-report pain is the gold standard as what the patient is suggesting is what should be believed by the nurse. Observation of patient's behavior and assess it so the nurse can adequately address the pain levels, thus still reflecting on the multifaceted reality of pain. Nursing Intervention 4, ECG. Since the patient is complaining of chest pain and shortness of breath, The ECG is a vital piece of technology that can indicate issues within the heart. Rate and regularity is the first thing the nurse should look out for within the graph, and should be evaluated according to James, which he is mildly obese and also signs of distress from his blood pressure readings. ECG also gives indication of the autonomic system, any heart blocks in which area it would be. Premature beats, if any, will affect the regularity of heartbeats. It improves the reliability and accuracy of cardiac monitoring, as this would be deemed necessary as James is complaining of chest pain. If the ECG shows any differentiation between the SD signal or higher T waves, this could be a result due to coronary syndrome. There are many factors that can contribute to differentiation between the results of an ECG. A physician should be present to ensure accuracy to these findings and readings. Nursing Intervention 5, troponin levels and the heart score. Blood troponin levels check again for accuracy of data, checking for single high sensitivity cardiac troponin T, if high levels would indicate risk of myocardial infarction. Checking for this is significant as troponins are found in heart muscle fibers that help the heart muscle contract. If levels are elevated within the blood, indicates damage to the heart. Cardiac biomarkers released when myocardial cells are damaged because of ischemia. The heart score. Designed to be performed by a specialized nurse or physician, predicting the short-term occurrence of a major cardiac event. The tool is used for risk stratification and decision-making in acute chest pain. Can also be used to measure evaluation of condition if it is improving by seeing the magnitude and direction of discordance in heart scores.